I've been driving a four-wheeler car for the last 17 years or so. And highway driving in particular has always been extremely relaxing for me. Interestingly, when I first began to drive on the highway, it was quite uncommon for girls to be driving alone. And so I went prepared with some basics. There was a manual for changing tires and a very reliable stun gun. The longest drive I've ever done was in 2015 from Cochin to Kerala, and I sort of sliced through the southern peninsula, and it was just heaven. It was just the road, the sky, and a lot of roadside idli stops. The scariest drive I've ever done was from Delhi to Shimla in 2016, which is also when I had my first car crash. I had never driven in the plains in the winter before, and I had no idea of the density of fog that accumulates on the highways early morning on a January day. It was so thick, I couldn't see beyond the bumper of my car, and I remember Googling, how do you drive in the fog? And the answer was follow the car in front of you. So I did that, and for a good 100 kilometers or so, it went pretty well. What Google did not tell me is that you can't see what the car you're following can see. So you have to keep that extra distance between the two of you. And I didn't do that. So when we came in line with a stationary truck, the car in front crashed into it, and I crashed behind it. Luckily, nothing happened to me, and my car kept on moving all the way to Shimla. But I always think back and I wonder three things. If the car had stopped in the middle of that isolated highway, what would I have done? If I had been injured, what number would I have called? And lastly, if I had been unconscious, would anyone have helped me? This is Sonali Acharji, and you are listening to Health Wealth, a podcast to discuss, debate, and find solutions to today's most pressing health concerns. In 2021, India lost 1,53,000 lives to around 4,13,000 road crashes. And if you break this down, it would mean we had 1,113 road crashes and 420 deaths every day, which is about 47 crashes and 18 deaths every hour. In 2022, that number went up, not down. And these crashes cost us a lot more than just lives, even though that by itself is alarming enough to take action, but there is an economic factor to it as well. Young adults in the age group of 18 to 45 years account for around 66% of the victims in these crashes. And it is estimated that these yearly deaths and injuries result in an economic loss equal to around 3.14% of our GDP. Sometimes I feel we've become so desensitized to a stranger getting hurt or losing their life, but really, all of this ultimately connects to us as well. Now, there is no highway in the world where there are zero accidents, so even as we put our efforts into reducing crashes, and we have pledged on a global forum to reduce crashes by 50% in the next 6 years, but we also need to think of a mechanism to save and rehabilitate lives should one happen. Many road safety organizations have been putting out a very compelling argument that India should have a right to emergency healthcare law, where no hospital can refuse to give me the care needed to save my life if I arrived in a critical situation. A national framework is important to guarantee this. To discuss what such a framework would look like and why saving lives after a road accident has a lot more elements to it than the obvious, I have with me today Piyush Tiwari. He is the founder of Save Life Foundation, which works with various governments to investigate road crashes and improve road safety on our roads. Hi Piyush, how are you?
Hi, Sonali. Thanks so much for having me as part of this podcast. I'm so glad you're raising this very crucial issue today.
Yeah, thank you so much for joining me. This is actually my favorite moment of the year because it means that the highway fog, smog, or whatever it is, it cleared up. So one can go back in the road. It
Thank you.
it seems quite unreal to me that, it's 2024. We have people going to settle onto Mars, and we're sending everything to the moon, and we have AI, and we have so much of tech, and yet death by car crash, it seems to still be on the rise. So I suppose we could start with, what are we doing wrong?
Sure. Just to put this entire issue in perspective,
Mm.
road crashes actually are the eighth leading cause of death globally. We lose about 1.4 million people around the world every year. And this is the only cause of death in the top 10, which is pertaining to traumatic injury. So it is a global public health issue as we
Mm-hmm.
speak about. Now, unfortunately, 93% of these fatalities and injuries are suffered by low and middle income countries like India. And India in that entire list, unfortunately, has the highest number of fatalities reported, in the world. So yes, there is a huge challenge, and there are various aspects that are involved in contributing to this issue. So when we talk about what are we doing wrong, there are fundamentally four broad areas, or the four E's of road safety as we talk about it. When Save Life Foundation investigates road crashes, we look at the human factors involved, the infrastructure factors involved, the vehicular aspects involved, which fundamentally come together to help us reconstruct the crash. But even beyond that, what fundamentally also plays a role is, as you mentioned earlier, is the trauma care piece. Is that besides engineering, enforcement, human behavior, what is happening once a person is injured? So now the challenge is that in each of these different areas, we have uh, fractures that currently exist. So when we talk about road engineering,
Mm-hmm.
while the surface of the road over the last many years has improved dramatically, allowing people to drive, have smoother rides, have faster, journeys, the commensurate safety infrastructure that is required to ensure that in the event of a crash, people don't lose their life or limb is still, a part of the challenge that we are, talking about. Uh, for instance, many of our highways, high-speed roads, still have a large number of exposed concrete structures. There are gaps in the median where somebody can take a, sudden U-turn. We have illumination issues. We have sharp curvature issues where, the curvature design is not that great. Then we come to the vehicular aspects, right? We talk about car safety. Now, car safety has also improved quite dramatically in the last few years, but is it accessible to everyone? Is vehicular safety accessible to the person who does not have a car and ends up riding a rickety bus, with the risk of that bus falling into a river or a gorge? So where are those vehicle safety standards for the common man, right? And then we come, talk about the aspect of, uh, human factors, right? Now, the a vehicle in the hands of an untrained person is a weapon. And to operate that weapon, you not only need a license, but you actually need proper training to do it, right? Now, what are the structures and systems that are currently governing the training of our drivers, many of whom drive for earning a living? So how do we connect accessibility of that particular skill set with the need to get a license quickly so you can feed your family? So I think there are a number of areas that require redressal. Now, the good news is that some of these things have been addressed over the last few years. It's a slow process, but we have, seen some movement. So, for instance, in the aspect of trauma care, India now has a Good Samaritan law. So you spoke about, wondering whether somebody, if you were, God forbid, injured, if somebody would
Mm-hmm.
come and help.
Yeah.
Now, there traditionally always been enough people who, make videos, be bystanders,
Mm-hmm.
but there traditionally always been people who will take that step, who
Yeah.
want to help, but have felt hesitation in doing that. And so that issue addresses it. So,
Yeah.
coming back to your point about what we're doing wrong, I think there is an understanding of what needs to be done, but the progress in fixing those gaps and fractures,
Mm-hmm.
needs to pick up pace.
Yeah. I mean, you mentioned the Good Samaritan Law, and I think perhaps we could just maybe touch upon, what is this law and what does it offer me if I were to help someone in a car crash? Because I still think that a lot of people really don't know that what this law offers us.
No, absolutely. I'm so glad you asked because this is the only way we can reach people,
Yeah,
right? To tell them about
yeah.
the existence of this law. So back in 2008, I had founded the Save Life Foundation following the death of a young family member in a road crash.
Mm-hmm.
One of the factors that were involved in causing that demise was the aspect of bystander inaction, people actually not coming forward to help. And that entire incident left me pretty devastated and confused about what really was going on with the population. And after about 4 years of trying to understand the issue, talking to policymakers, figuring out that it was not apathy but a very profound fear of the law, that in 2012 I moved the Honorable Supreme Court of India, asking for insulation uh, from any kind of legal and procedural hassles for Good Samaritans who come forward to help the injured person, with the intent that to encourage more people to come forward. The case went on for about 4 years. There was a fair amount of opposition. There was a fair amount of legal sort of discussions and arguments around that. But on 30th of March 2016, the Supreme Court, using its powers under Article 141 and 142 of the Constitution, instituted a nationwide Good Samaritan law that fundamentally protects all of us from three things. It protects us from police procedures and formalities like being compelled to give our name, address, details if we have simply played the role of a good Samaritan and trying to rescue an injured person. It protects us from detention at hospitals. If we take an injured person to the hospital can't say that you have to wait till the time police arrives. You can leave the person and you can leave, right? You can leave the person at the hospital and then you can depart after that. And the third thing it protects us from is prolonged appearances in the court if you, let's say, agree to be a witness in that case. So what the Good Samaritan law now states is that police can't compel you for details,
Mm-hmm.
hospitals can't detain you, and courts have to wrap up your examination in the fastest possible manner so that you don't have to be subjected to coming to the court again and again.
Yeah.
And any adjournments caused by either side causing you inconvenience will then have to be compensated to you in an appropriate manner. So
Yeah.
this entire system now protects people from police formalities and procedures, intimidation, any kind of harassment, and so on and so forth.
Yeah. Another thing, apart from harassment, which often gets in the way of someone helping somebody who's injured on the road, is that most of us really don't know what to do. You know, we really don't know basics of, emergency bystander care. Um, is this one of the reasons also why, we lose so many lives every time say a high velocity car crash happens?
You see, I think what we need to do is to shift the onus of saving a life
Mm-hmm.
from a common man to the system. If you see any developed country, or if you see a developed system, let's not
Mm-hmm.
even talk about country, right? Because there are enough developing countries that have a developed trauma care system.
Mm-hmm.
You see that the bystander's role fundamentally ends after making a phone call to invoke the authorities to come and carry out professional intervention to save someone's life.
Mm-hmm.
If there is a high velocity car crash and the victim is choking on their own blood and requires intubation, a common man in any case can't do that.
Yeah.
So you need professional care to be invoked in that period of time, and professional care has to respond. What the Good Samaritan can do is that the Good Samaritan is trained in basic trauma care,
Yeah.
which is bleeding control, CPR, and C-spine immobilization. Just these three skills. Then they can perform those skills to perhaps prolong and improve the chances of survival that a victim might have while the services arrive. But definitive care or advanced care can only be provided by trained professionals.
Mm-hmm.
And that is why we have been talking about this entire right to trauma care piece, where those missing systems can be established and respond effectively. But just fundamentally to close out the bystander care point, the three things to remember are check, call, care. Check for scene safety, which means your own safety first. Check for the condition of the victim. Make the call for help first, which is that ambulance, police, whoever you want to call, and then provide care, because while you're providing care which is not definitive in nature, somebody is on their way to then provide more advanced, more definitive care with equipment and with various other paraphernalia that they require to save someone's life. But check call care is the principle to follow in the event you end up witnessing a crash.
Yeah. Well, I spoke with Dr. Yatin Mehta, who is the chairman of the Institute of Critical Care at Medanta Hospital in Gurgaon. And there were two things he pointed out to me which I had no idea about. Number one is you don't move the victim at all. You don't actually pick them up because they might have spinal injuries or neck injuries, and you're just going to make it worse. And number two, you don't give water because that seems to be a reflex. We give them some liquid or something to drink, but that's actually not the wisest thing to do, especially if they've had some sort of lung or chest injury. He also mentioned, interestingly, we have this golden hour rule, which is, within 60 minutes, you should get a person who's injured to a hospital. And there's a platinum hour now of 10 minutes, for, seriously injured people. But interestingly, he said that's just a ballpark figure. Every minute delayed is reducing the chances of a successful recovery. Do you think our ambulance system and our support network, particularly on highways, is equipped and mobilized enough to really get me, like, say I've broken a rib, to get me to that particular treatment or that particular doctor in time?
I think the key thing to consider here is what we call a chain of survival.
Mm-hmm.
Chain of survival is a series of interconnected events that must take place to save someone's life. It begins by the very act of making a phone call for help to arrive. You need to know what number to call, and therefore, like a 911 in the US or a 112 in UK, you need a single number across the country for all kind of emergencies and not have multiple numbers like we have across India, so it doesn't create confusion in people's minds, right? So it starts from there. It moves on to bystander care, which is while the help is arriving, what kind of care can be provided. And you're right that one of the principles is not to try and move people to prevent aggravated injury. And if you are lifting somebody, you do it with proper training, which is why I spoke about C-spine immobilization, that you immobilize the C-spine so that the person doesn't get injured further while during movement. The third piece is, as you spoke about, is the ambulance piece, right? Is the ambulance really, responding? So ambulance has two aspects to it. One is the response time. How quickly are ambulances arriving on scene? Now, we have seen response times varying from, 18 minutes to an hour, just for the ambulance to arrive. Now, that fundamentally means for somebody who is critically injured, that's fundamentally death, right?
Yeah.
So I think what we need here is to relook at our ambulance system in terms of response times and start optimizing the placement of ambulances in a manner that they can respond to known heat zones or known black spots in a much faster manner as opposed to being stationed at toll plazas and then taking whatever time they take to arrive at the crash site. Then we come to the aspect of the in-hospital care, right? That what is the connectivity there? Now, an ambulance fundamentally is meant to preserve life during transfer. Are ambulances actually doing that? Are they actually able to preserve life? Are they actually able to ensure that the paramedical treatment that's required is taken before the handover happens to a surgical team or a trauma team in the hospital? Currently, there is a huge gap in that skill set, and that is not happening in most cases. The advanced trauma care that has to be provided inside the ambulance is rarely being provided at this point of time. And then when we come to the hospital, we don't know what the facilities in the hospital are because India does not have designation of hospitals. You don't read outside the hospital whether it's a level 1 or a level 2 or a level 3 or level 4. Yeah. Level 1 is an AIIMS-like trauma center that can have a helicopter service coming in. You have an immediate transfer to the surgical team and so on and so forth. Level 4 is the most basic. So you might end up having that there might be a victim with a open brain trauma that might end up arriving at a level 4, primary health center where they can do nothing with it. right? But they did it because their brief is to take the person to the nearest hospital. So there has to be a lot more intelligence that has to be built in this entire system, and not, not get stuck in the rot of, just trying to follow the protocol. I think the protocols have to be amended, and the entire chain of survival has to be established in the country as an integrated system, as opposed to, systems that are working in silos.
Yeah. And once I arrive at the hospital, we've been talking about the right to emergency or trauma care bill, and that is the hope is that that will make the situation better. So, could you maybe tell me a bit about how will it make things better? Like, do people get refused trauma care today?
So, I'll give you an example
Mm.
from a different area. Um, Education was always considered to be a fundamental right of every citizen, of every child, right? But it is not until the Right to Education Act came into place that the systems that are involved in guaranteeing that right started getting built up. And it's still not there, but you know that now it is guaranteed. And now you know that those systems have been defined, right? That's the same thing with trauma care. Trauma care fundamentally is considered to be a fundamental right because it helps preserve your fundamental right to life. And there are Supreme Court judgments that say that it is to be considered as a fundamental right. But the systems that are involved in guaranteeing that right are, as I mentioned earlier, either completely fractured or entirely missing. So what the law will do is that not only will it address the aspect of refusals. Now, why is a refusal happening?
Mm-hmm.
If I'm taking an open brain trauma victim to a primary health center, they will refuse because they don't have the surgeons or the facilities to treat that patient, right? What they can do is they can provide basic packaging to the victim, so the victim perhaps survives the journey to a center for higher care. So this entire aspect of refusal is driven by either competency issues or funding issues. And what a law can do is to address both aspects, is to bring in the systems that are required, build competency in those systems, and figure out how to fund that system so that what we consider to be a right is actually delivered as a right on the ground, fundamentally.
Right. And as an organization, I find this very interesting, but you adopt highways. Um, how do you improve safety on those stretches? And are there some, good practices or lessons that you might have learned from the highways you've taken up?
Sure. So let me give you an example. In 2016, um, we adopted the Mumbai-Pune Expressway. That year, Mumbai-Pune Expressway saw 151 deaths. It's only a 94.5-kilometer stretch of road. That's a 151 deaths, on that road, which was the highest number of deaths compared to any highway in the country at that point of time. Now, between 2016 and 2023, there has been a 58% reduction in deaths on that road. Now, how did that happen, right? That delta is what we call the Zero Fatality Corridor program.
Mm-hmm.
Now, we started the program by forensically investigating what was going on. And when you forensically investigate, you go beyond driver error. You start looking at the system in which people are operating. You start looking at infrastructure, vehicles, of course, human behavior, but human behavior not just of the drivers, but of the system operators also, of people who are, sort of peripheral to that system also. So we studied all of that, and we discovered after that analysis and studying the crashes is that Mumbai-Pune Expressway had about close to 4,000 engineering-related issues across 50 odd categories. We realized that enforcement was very, very limited and not using technology at all, which limited the scope of enforcement altogether. We realized that while there were ambulances, they were not very well equipped. They were not enabled to respond to mass casualty incidents. The places where people were being taken to were not very well equipped or were too far away from the highway. And then we discovered that also the public had no clue what kind of crashes were happening and how they should behave. So we had a large number of rear end collisions. Vehicles would go and ram into parked vehicles, and you'd have, families altogether getting wiped out in such crashes, right? So we then, when we partnered with MSRDC, we found incredible, acceptance from them, in terms of recognizing that there were issues and also fixing those issues. So together with MSRDC, which is the Maharashtra State Road Development Corporation, we work to address 3,500 of the 4,000 engineering issues. We Save Life Foundation funded the establishment of 4 roving enforcement cameras on the expressway. We deployed 2 vehicles to prevent rear-end collisions. We upgraded 3 ambulances. We upgraded certain trauma centers. We carried out mass awareness campaigns every quarter non-stop. And all of that came together to reduce the number of deaths on the Mumbai-Pune Expressway, which then encouraged us to adopt more highways. And as on date, we have an MOU with the Government of India to adopt 100 highways and 100 districts across the country to deliver a similar reduction in fatalities on those roads and districts, hopefully leading to a mass reduction.
Right. How long did it take you to fix these 3,000 odd engineering defects, roughly?
So, the first big drop that happened was in the first year itself. A large number of vehicles were crashing into exposed concrete structures like bridge pillars or bridge parapet walls, or even improperly deployed curbstones.
So what do you
that
do
would
to
disable
those
vehicles.
pillars then? You cover them or you remove them?
Yeah, we attenuated around them. We convinced MSRDC to crash barriers around them.
Okay.
We closed all the illegal gaps in the median. There were 110 gaps in the median when we started the project, on a 94-kilometer road. So you can imagine the frequency of gaps in the median. And today we have 17, and all 17, are being treated to become, safe gaps, so that emergency vehicles can take safe turns and all that.
Yeah.
So we do have that, those in the first year itself. I would say that about 80% of all concrete structures were attenuated around. We either had crash absorbing barriers, or we had aluminum MBCB, they call metal beam crash barriers that were deployed. So it took us about, I would say about 3 years to address every single of the issues that we had identified, and then we focused on enforcement and other aspects, right? And even right now, we had 151 fatalities in 2016. Last year we had 63. So even though it's a big drop, but it's 63 too many for us to accept. And those 63 have happened because of a variety of issues that we are now working to address. Some happened because of new construction zones that came up that were not properly treated. Some happened because of brake failing incidents where a truck would go and ram into multiple vehicles and then topple over them. We had one bus crash that could have been prevented. So each and every one of these issues is getting addressed, and our goal is that in the next couple of years, we'll see India's first zero fatality highway, come through that entire process.
And in these corridors, is there some role of technology in sort of noticing when a crash occurs and then connecting? I mean, can we use tech to be the bystander?
Absolutely. There is, there's a whole technology platform called ITMS, which is Intelligent Traffic Management System. There are also ATMS, which is Advanced Traffic Management System. Fundamentally, it's the same thing. But the idea is to use AI-based cameras to do incident detection, which means the moment your camera has detected an incident, alarm bells ring everywhere, agencies are informed, and then you have a much faster response time that goes in. So ITMSs work both towards prevention of crashes through enforcement, but also better response to crashes when they take place. What they do require is response infrastructure at the back end. If I have a AI-based camera that's seeing a crash occur, but I don't have on-ground capabilities to respond to that crash quickly, then the entire system will fail, right? So what we're seeing is that even in places that do have an ITMS system deployed right now, the on-ground response mechanisms are not appropriate, are not adequately established. So that marriage of the ITMS with the on-ground infrastructure has to happen if we want to ensure that this technology piece is successful overall.
Yeah. An avoidable loss of life is perhaps the most unfortunate thing that one can come across. And given our achievements today as human beings, I think we should certainly find ways to reduce road crash fatality. And most certainly, we also need to know a lot more about what we can do as bystanders. And thank you so much, Piyush, for all that you've shared. I think awareness is always the first step towards change. Thank you very much.
Thank you so much. Thanks again for raising this issue and having me on your podcast.
Thank you. I'd met somebody who lost a limb because he fell asleep while driving, and he says he went into a state of highway hypnosis, and he was alone and the road was empty and he just dozed off. And when he looks back, the worst thing was being injured and not knowing which number to call. And he was just lying with a lot of pain and just calling number after number. It's been a very long time, almost 10 years since then. The physical trauma has healed, but the emotional trauma remains. And this person cannot get into a car and he's just stopped driving completely. So, even as we talk about physical care and the right to emergency health care, possibly we also need to in the future talk about how do we give accident victims emotional support, and can we have a formal system to also support this? Is this something you'd like to know more about? Do let me know by writing to pods@indiatoday.com, or you can message us at 8588 966 996. And if you enjoyed this episode and it contributed something meaningful to your awareness of road crashes and road fatality, we are available on YouTube, Apple, Google, and Spotify. Please do rate us. Thank you for listening.